We are back on MorningLine. Thanks for joining us on this Wednesday. Nick Barris here along with Dr. Joshua Beckman over at Vanderbilt Vascular Health. He's a cardiologist and always good talking to him this time of year about heart health and the like. Wanted to ask you, just with other things that have developed over the past several months, or actually 2 years, are there connections between individuals who have had COVID and then end up having some heart issues that come with it? Maybe they had heart issues to begin with and COVID made things worse, or maybe they got COVID and developed heart issues. Is there any connection there that you've seen?
Yes, unfortunately, there is a connection. And so, we have conversations about whether or not COVID is done after you recover from the initial infection. But even just recently, there was a pretty large study that was published showing that patients who have COVID are more likely to have heart rhythm problems, are more likely to have heart attacks, are more likely to develop chest pain, are more likely to get heart failure, are more likely to have blood clots like pulmonary embolism and deep vein thrombosis. It's not something that you can just sort of ignore and not pay attention to. Is it 1 out of every 2 people? No, it's not that high. But can it be an additional 1 or 2 out of 100? Easily. And so it's not something to ignore. These are, if you just imagine that there's been 70, 80 million people in the United States who've had COVID, we're now, just think about what it's like if we just took 1 out of 100 of them, for the number of people in the U.S. who can now have these problems that they would not have had without it. It's a bit terrifying.
I know. I've heard of cases where folks have had the arrhythmia afterward and dealt with it. And sometimes it's been in some senior folks that maybe had some heart issues to begin with, and it just made things a little worse for them, a longer recovery period.
Yeah, there's that too. Certainly up front, if you come in with heart disease, the recovery can be a bit more difficult and you can have more complications. I have to tell you, I've seen patients who have no symptoms at all, and they've had things like stents placed and the stents have gone down.
Huh.
It is just not a mild problem. I'm really grateful for people that don't get severely ill, but it is something you want to avoid as much as possible because complications arise. I was just rounding in the hospital and lots of people were admitted they didn't know they had it, but it made their illness worse, their other illnesses worse.
Oh boy, so you guys see it even in vascular department there, COVID having an impact. I guess it affects probably every department at that hospital, doesn't it?
Yeah, it is all over the place. There is not one service that is untouched.
Oh boy. Well, hopefully it is getting a little bit better. That's some of what we hear right now, and these vaccines and the like seem, and a lot of them coming, of course, from Vandy and the wonderful work they've done. All right, well, let's just talk more than just about some of this general heart health. As I said, we can take some phone calls and the like. You're always saying up front, the best thing you can do for your heart is don't smoke. But if you're already not a smoker, aside from when you say eating well, which means just a well-rounded, balanced diet without too much saturated fats and exercise, I mean, are you a believer, if you do all that you need to take any supplements?
Yeah, no, I think if you live in the United States of America, in general, you get all the different vitamins and minerals that you need. I really don't think that supplements have a particular benefit. I know that there's lots of promises that they do, but I would really focus on healthy diets with lots of vegetables and fruits, trying to avoid the saturated fats, like you just mentioned, fried foods, red meat, and exercise. You don't have to be a marathon runner, but routine activity, 150 minutes a week, even if just walking, will make a big difference.
Okay, so yeah, you just have to try to stay active. So I wonder, in your experience dealing with people, what do you find is the most difficult thing for them to achieve? The exercise, the dietary standards? I know it's very hard for some people because it's an awful addiction to quit smoking, so I'm not really including that. But what are the biggest challenges you've seen in some of your patients where they just say, gosh, I'm having a tough time with this, doc?
So for the really busy people, I think their most difficult thing is finding time to do exercise and activity. And so I try and encourage them to incorporate different kinds of activity into their daily routine as it is. The folks who get up really early, get the kids ready for school, run off to work, run home, prepare meals for the kids, and then only get to sit down at 9 o'clock at night. I feel for them, and I know what that's like. You have to build in some walking if you get a little bit of lunch, or if you park far away from your job. do something. There are other folks who it's really difficult to find lots of healthy foods in their neighborhoods. That's a more difficult one. Sometimes there's food delivery options. Otherwise, you just have to try and make do and get as many fruits and vegetables and healthy meals as you can. I really feel for folks who have to, for whom it's really difficult to get healthy, nutritious meals. Sometimes things are just not set up to make it easy. But the answer really is that this is for you. Yeah. We want you to feel better and live longer. And so I think you're worth the effort.
That's the tricky part of it, is because when you think about convenience and cost, you can go through the drive-thru at a bunch of fast food places. It's quick. Okay, yeah, it tastes good. It's not super expensive, and that's where you see a lot of people getting their food, or certainly their lunches on a regular basis. And I'm not a hypocrite here. I eat my share of fast food on occasion, but I really do limit it. And if I eat too much of it, I feel sick. All right, because my body's not been around it as much anymore. But maybe, yeah, reel off some of the foods that you can find in most any grocery store that are also affordable. Because as you well know, some of the very lean meats that are fresh and some of the vegetables can be a little more expensive. What kind of foods that are maybe tasty too you can get in the grocery stores that's heart healthy?
Well, all the fruits and vegetables are heart healthy. There's no doubt there. And whichever ones you can get, I would recommend. It does not have to be really fancy pomegranates on a daily basis. Apples, pears, grapes, strawberries, blueberries, different kinds of peppers, cucumbers, lettuce, carrots, cauliflower, broccoli. I mean, there's a wide variety, and certainly during most of the year, these are not very expensive foods. You know, for the meats, for example, chicken is a very reasonable option. Fish, if it's available, is a reasonable option. I'm not saying cut out red meat always 100%, but minimize it as part of your diet because it's not so good. You want more of the complex carbohydrates, not the chips and pretzels and things like that are metabolized really quickly. They give you a quick hit, and then they just make you hungry later, about an hour or so. And so more of the foods like oatmeal, for example, that'll keep you feeling full and satisfied over, from breakfast to lunch. Things like that, I think, are a good way to go.
Oatmeal is a great suggestion, and it really does work. And I'll put a little bit of honey in my oatmeal with maybe some pecans or something. And you know what? That's darn good stuff, oatmeal. And can you tell me, though, you always say, and you're good at saying, when you eat these fruits and vegetables, you want lots of crazy colors. And, you jump out at you like blueberries. So what is it tangibly about the colors or the antioxidants? What effect do they have on the heart? I mean, when you eat a blueberry and whatever comes out of that blueberry, what does that do? Does that help coat your veins and protect them? Or what does that do? Oh, you know what? He froze. Okay, he's thinking about my question. I'm going to have him explain that and more when we come back with a good doctor right after this. Stay with us.
This is a Storm 5 weather update. For weather on the go, download the Storm Shield app.
I'm News Channel 5 weekday morning meteorologist Nikki D. Ray. We are looking at a warmer day heading in our direction. We're